From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is clinical excellence. Bon Secours means good health, and one way our clinicians interpret that is clinical excellence. To drive that point home, Bon Secours created the Center for Clinical Excellence. But many are asking, just what is the Center for Clinical Excellence? Well, to find out, I asked Andrea Mazzuccoli, Chief Nursing Officer for Bon Secours Health System, during her recent visit to Dateline HSO, the health system office's new version of the HSO staff meeting. Let's listen to what Andrea had to say. What exactly is the Center for Clinical Excellence?
So the center was started in 2009, and we had a lot already going on in the system to improve the care of our patients. So Connect Care had begun its design and its validation. Clinical transformation efforts around sepsis and palliative care had started, and we needed a way to organize all of the efforts. So the center was created. Dr. Priest and I created the center as a way to organize and provide a framework from across the system, a way in which our clinical providers at the bedside and the leaders could come together and think about what our future was going to look like for Bon Secours.
So when you say, when you call it a Center for Clinical Excellence, I mean, is there a building? Are there people in the building that are running around doing, but I mean, what, is it an idea? Is it a concept? Tell me a little bit about that.
It's an organizing framework. So some people want to come and see the center and kick it and see the bricks in the mortar.
Right, yeah.
And very much how I think our healthcare system has operated for a long time. But I think the center is created in a large part about the way our healthcare delivery system is going to be in the future. And it's about a network of connecting our providers in a different way. In my mind, the center really is a response to our calling. The American people and our community said, this isn't the way we want our healthcare delivered. It costs too much, it's too fragmented, the providers don't know me, they don't talk to each other, I don't have the information.
Too many unhappy people.
Too many unhappy people.
Yeah, so you talked a little bit about clinical transformation and Dr. Priest and getting started. How did this all get started? Can you give me a little bit of an idea on that?
Well, I think it started, again, in response to delivering a different system, a vision about connecting providers with patients in a care model that allowed continuity, allowed our continued careism to show through. You know, we know in the future that our role as providers with our patients is going to look different, our role with each other. And singularly, I think the center and clinical transformations work is about creating an experience of care for our patients that differentiates Bon Secours.
Good help to those in need comes in many forms. The Center for Clinical Excellence demonstrates that idea every day. In other news, what do you know about the Primary Care Integration Collaborative? Well, if you've read the most recent Clinical Informatics newsletter, you know quite a bit. In the 1990s, hospitals and health systems were buying physician practices as a method of increasing inpatient market share. And while that may have appeared to work on the surface, it was not particularly successful. Why? Well, during that period, the idea was to take inpatient market share away from competitors and wasn't really focusing on the patients. Today, that has changed, at least at Bon Secours. According to Jim Fuzzy, Vice President of Physician Services at Our Lady of Bellefonte Hospital in Ashland, Kentucky, healthcare is migrating away from a production orientation to outcome determination. The new paradigm requires a more holistic approach to enhance the patient experience. In other words, Bon Secours is focused on delivering high-quality, efficient healthcare that is data-driven. Enter the Center for Clinical Excellence and the Primary Care Integration Collaborative. And the objectives of the Primary Care Integration Collaborative align with our SQP or Strategic Quality Plan. Interested in finding out more? Look for the latest Clinical Informatics newsletter on Iris. It is on the Clinical Transformation Community. To get there, go to the key communities on the mega drop-down list and look for the Clinical Transformation link. The newsletter is in the right-hand column of the page. The Center for Clinical Excellence and the Primary Care Integration Collaborative. Daily examples of being good help to those in need. Finally, the Stewardship Program was launched by Bon Secours with a focus on prosperity, quality, and stewardship. It is targeting an improvement of $150 to $200 million over multiple years and is focused on improvements in several areas, including systemness, resources, duplication, attrition, and careers. We've been telling you about the Stewardship Program for a while now, but you can find out more on Iris. To read more about the Stewardship Program, simply search for the term Stewardship Program. Additionally, if you have any topics you would like to see addressed in the monthly Stewardship Program updates, please email Peggy Mosley. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. We leave you today with a few snapshots of that jolly old elf who recently paid a visit to Our Lady of Bellefonte Hospital. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.